All right. I stand in the way of wine reception, so I know people are eager to get there. But I just wanted to just offer just a couple of minutes of reflections, and then we have our prizes as well for our raffle. I just want to first just thank just what an amazing day this has been of discussion, of just illuminating on this idea and this intersection of high-tech medicine, soft touch healing, really the dynamic role that technology has in advancing integrative health, and healing through this medium of technology, artificial intelligence, and health equity. So we, just to briefly, we had an amazing introduction this morning with Dr. Peter Wayne and Andrew on just setting the tone by emphasizing the need for new dialogues in integrative health and why this dialogue at the intersectionality of technology, artificial intelligence, and integrative is so critical. A plenary talk by Dr. Chidea has really addressed the critical role of digital technology in integrative health research, underlying scientific rigor and ethical considerations as pillars for promoting health equity. We had really amazing short talks and insights from Paula Gardner's work, the innovative work on online group medical visits, Abby Batchelder's exploration of technology for assessing nonverbal expressions of self-conscious emotions, Adam Rodman's thought-provoking discussion on biases and language models affecting human-computer interactions. And we've had just a phenomenal panel discussion on these themes. In the afternoon, Paulo Bonato's presentation shed light on technologies that foster healthy aging, independent living, and we had captivating talks on Shyama Patel's vision for democratized health data, Caitlin Becker's research on redesigning robotic touch, Dina Katabi's application of artificial intelligence to healthcare transformations, and really these discussions deepen our understanding of integrating these technologies into real world settings. And then just right now, as you saw, we had just a really amazing just research and just really new ways of thinking. Vitaly Napadov's work on neuromodulation techniques inspired by East Asian medicine and how these theories of respiration rhythm influence acupuncture, even needle insertion and stimulation. We had the studies on gait assessment, tele-tai chi monitoring, hyperscanning patient-provider interactions. You can see this today demonstrated really the synergy of innovative technology and integrative health approaches. And it really underscores the need for collaboration across disciplines. And tomorrow we will see even more of that and even more, I think, I would say provocative and discussions and insights as we delve deeper into the future of integrative health. So without further ado, we have, I want to introduce, next slide. Mary Peng. All right. This is for a networking reception. Mary obtained her Master of Science in Media, Medicine, and Health from Harvard Medical School in 2024. And this is really, her biography is on our Whova site, but as a self-taught artist, trained public health researcher and implementation scientist, Mary strives to fuse art, technology, and science to address crucial public health issues. Her contribution to this evening's reception centers on her fascinating work at the intersection of art, science, and design. She leverages data visualization, multimedia storytelling, and an artistic expression to promote understanding and empathy in health, culture, and well-being. So I will turn it over to Mary for a couple of minutes to just share and give an introduction to the exhibit that is outside.
Awesome. Hi, my name is Mary. I know this is the end of the conference. So I'll keep it short and sweet. Thank you so much for the introductions. I'm a self-taught multimedia artist and trained in social and behavioral sciences, medical research, and public health research. So operating in all these very different spaces, I always think about what's a scientist's job and what is an artist's job. If a scientist's job is to remove the question marks from our lives, maybe an artist's job is to keep our realities with all its uncertainties, with all its veracities on the agenda. So I hope to be a scientist that speaks art and an artist that speaks science. So I started playing with the synergy of science, art, data, design, technology a few years ago, first through data art, which I think of as this artistic practice that relies on the usage of real life data, scientific data, and sometimes biometric data to convey emotive messages to the audience. Data art, I think, lies between conventional data representation and data visualization that uses like very simple visual elements as ways of representation and a more abstract and imaginative way of expression. So I'm very grateful for the opportunity to share 4 pieces of data architecture, 3-dimensional data architectures that I created for this forum, all of which were constructed with real life data and biometric data about the field of integrated health, where the artistic elements of each was created to convey the hope, the growth, the energy, the momentum in the blooming field of integrated health, ranging from the growing market size to the growing scientific research about mind body connection to people's increasing adoption of integrated health strategies, like blooming and dazzling flowers that keep growing and reaching for the sky. And with my recent publication on a randomized pilot study on psychedelic art and its implication in mental health and digital health. This display also contains 2 motion art pieces, one showing a psychedelic motion art piece that I created by synchronizing the motion parameters of this piece with real-time biometric data such as heartbeat per minute and breathing speed. And another motion art piece we'll be showing the use of visual aids to facilitate mindful breathing exercise. So yeah, I'm really grateful for the opportunity. I hope everyone enjoys the display. 5 pieces are on the first floor, and the last piece where I use visual aids to facilitate mindful breathing is on the second floor. Yeah, so thank you for having me here, and hope everyone enjoy.